Many people who might be watching or listening today know that the SNAP program has been the topic discussed by Congress, et cetera. And so changes are currently being implemented. You want to talk about what your understanding of some of those changes are?
Sure. So in July, HR 1 was signed into law. And basically, it makes cuts and structural changes to SNAP and Medicaid, the likes of which we've really not seen, really unprecedented. One of the things that HR 1 did to SNAP in particular is it expanded work requirements for what's called ABODs, again, acronym Able-Bodied Adults Without Dependents. Now people from 18 to 64 have to meet a pretty stringent work requirement. They have to do 20 hours a week or 80 hours a month of either work, volunteer, or job training in order to keep their benefits. Or if they meet an exemption for physical or mental health reasons that's documented, then they might be able to get an exemption. But if they can't, and they can't meet the work requirements, then they get a 3-month time limit on their SNAP benefits over a 3-year period of time. So we will likely see many people lose their benefits. We have no idea what's going to happen in terms of how many people that will be. I saw a statistic the other day that said in the first almost 6 months of HR 1 implementation, we've had about 19,000 individuals lose their SNAP benefits. Some people may lose their benefits because they'll fall through the cracks. Others will lose benefits because they won't maybe know what they need to do. And so, they'll just lose their benefits. They'll have to reapply again. So we're deeply concerned about the impact of that. We're talking about pretty vulnerable populations. There's also no more waivers for most people who are unhoused. Some of our veterans will also be subject to these ABOD work requirements. Now we have, actually ABOD is a misnomer at this point because it's supposed to be without dependents, but now they've implemented a rule under HR 1 that parents and guardians with children 14 years and older are now subject to these expanded work requirements. That's one piece of HR 1. It had a profound impact on a lot of our refugee and asylee communities. There's a lot of immigrants with certain statuses that will no longer be able to get SNAP, and that was effective immediately upon implementation. And again, I want to be clear that people who are undocumented have never been eligible for SNAP. These are folks that have a certain status that they were able to get SNAP benefits, and they're no longer able to do so in most cases. They also removed a utility deduction for SNAP, except for seniors and people with disabilities. And again, those deductions can increase benefit amounts a little bit, give that little extra boost, help the household out. So there's a lot of changes, and it's kind of complicated, but that have been implemented and are currently being implemented that, we're really concerned that we're going to see a lot of our households either totally lose SNAP benefits or lose a large portion of their SNAP benefits, which again is going to drive up instances of hunger and food insecurity.
Okay. So just to summarize, my understanding is the SNAP has always had some type of work requirement, but in many instances it was waived, especially in cities or communities where you had a high unemployment benefit.
Correct.
And right now, all that has changed.
Yes,
right?
For most of the counties, yeah.
And then also where, as you said, it used to be if you had a dependent, your work requirement was waived. Now there's a limit on the age. So
Correct.
if I'm getting SNAP and I am worried that I might lose my SNAP, where do I find out, or where can I get clarification on what's my work obligation? I'm thinking I can't just pick up the phone and call Lisa Pitz, which I'm sure you would try to help people, but I'm saying where should people go to find out?
So they can go to the state's website, newjersey.gov. There's a portal now that folks can sign up for so that they'll get updates sent to them. The state is notifying people who will now fall into this category and be subject to these expanded work requirements and some of the other changes, letting people know what they need to do. But people don't always receive the correspondence, or it may not be in the language that they read, or it may, so I think we want to make sure that we're getting the word out as much as we can. I would encourage all of our community-based partners to try to, let people know what they need to do, but they can certainly go to the state's website. If people who are receiving SNAP lose their SNAP benefits, or they need some legal assistance with their case, they can go to Legal Services of New Jersey. That's lsnj.org, and they can likely get some assistance from LSNJ with their SNAP case.
Okay, so it's not hopeless,
No.
right? Even though, as you said, it is devastating and it is change, and people don't always adjust to change. But it is possible for people to make sure they do what they need to do to comply with the work requirement. And as you said before, it could be education, it could be job training, it could be community service that people can do your 80 hours a month to comply. Probably for some people, the toughest part is going to be the documentation. Mm-hmm. Because as I understand it, most people are working, mm-hmm. but they might not be working all the time, right? They might have contract work, or they might have work and then there's a layoff and then they find other work. And so it's how do you make sure that you're volunteering or do something else in the middle there so you can document your 20 hours a week or 80 hours a month.
Yeah. And it may not, I think there's so many variables involved too when you're looking, when you're talking about folks that are living in areas where there's really like no public transportation, getting to and from a location, having sort of this patchwork in place where maybe, someone might try to get 10 hours a week volunteering at a local organization, and then they're working, as a cashier in a store for another like 10 hours a week, right? It's like patching it together. Having to make sure that you have all the sort of infrastructure and supports in place that you can actually make that work, which can be really challenging. But, I think the primary piece of this is trying to just educate people about these changes and letting them know where they can go, what they need to do, what resources they need to connect with to be able to do that so that they can keep their benefits, and then what resources are available to them if for some reason they lose their benefits unjustifiably and they need some assistance.
Okay. And as you said, Legal Services of New Jersey, which has a main office in Edison, but also has regional offices, do have attorneys who can help or can also provide information, which is really wonderful. Do you think there's certain populations that are disproportionately impacted by these changes, or, just by the food insecurity or et cetera?
Hunger and food insecurity does disproportionately impact people of color, and it does disproportionately impact families with children. Households with children are more likely to experience food insecurity than households without children. But of course, we have a significant, problem with hunger and food insecurity amongst our seniors as well. So
I would take from that to the extent people can reach out to their neighbors and people in their community, there are probably a lot of people who can use help. So people who might lose their benefits may start to then, I guess, reach out to food pantries, community food banks. Is there a network of options for people if, for instance, they lost their benefits? I mean, I'm assuming people are working together to try to make up that difference if possible.
Yeah, I think there's a lot of coordination happening on the community level. I think there is enormous concern amongst many food pantries and emergency food providers that, I have to say they will never be able to make up for a significant loss of SNAP benefits. And so many of the emergency food providers and communities throughout New Jersey are seeing unprecedented amounts of people coming for food assistance, even more so than during the height of the pandemic, which is crazy. But they are, and it's for all the reasons that we've already discussed. The housing prices, gas prices, utility prices, like everybody's really struggling. So there's a saying, rent eats first. Got to keep the roof over your head, right? Got to keep the lights on, keep the heat on, put gas in the car so you can get to your job. So that one sort of piece of the household budget that tends to be the first one that gets compromised is the food budget. So people will go to a local pantry and get a couple of bags of groceries to try to get themselves through the week, the rest of the month, whatever it is for people. But there is a large network of emergency food providers, and people are working together to try to meet some of the increase in demand. But again, they're already seeing huge increases in the amount of people coming for help. And I saw a statistic somewhere that said for every meal a food bank provides, SNAP provides 9. I think I have that.
Wow.
Right. Yeah.
Wow. Thank you so much for watching. Visit the description to find out more information about today's conversation. Be sure to leave a like, subscribe, and hit the bell if you enjoyed the video and want to be updated when our newest interviews are released.